love that job. That's a great job for me. I would be the perfect person, and I will help your company a lot, but I can't do it for less than 120. And they'll say, oh, no way, no way, no, no way. But you know what? Maybe I could do 110, because the companies expect you to negotiate. And I never met a man that didn't negotiate his salary, ever. Now, when I was saying this earlier, it's really true. It's hard for me to practice what I preach. I can negotiate for my kids. My daughter was in the hospital. I got her everything she needed. You know, I was just like, when my parents need things, my husband, no problem. My dog, I have a diabetic, sick dog. I mean, that dog is so well cared for. The people at the vet are like, oh, it's your dog. But for me, it's a lot harder. Now, I'm getting better because I'm practicing. And some of this you just have to practice. A really good friend of ours, her name is MJ Tossi. She teaches negotiation, and she has women go through a negotiation gym. And it's really an asking and taking risks gym. So the first week you go out and ask for something really easy. So I went to the dollar store, and I asked for a discount on some, like a table that was dented. I'm with my daughter, and I like this table, and I thought, I'm gonna try this, but I want 10% off. Like, I'm gonna have to go fix it. And so I said, I like this table, but I want 10% off. And this was to the sales clerk. My daughter said, Mom, you can't do that. I'm like, get over there. I am working on my negotiation gym. I don't want to hear from you. Like, go, 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 go. She's like, she was mortified. I was like, go to the car. So the lady said to me, you know, ma'am, we never do discounts, but I'll ask the manager. Well, sure enough, she came back, and the manager's like, sure, right? The sky did not fall. Nobody died. I mean, you know, and that, I mean, and that seems so crazy to think about it, but the risk involved in that. Then the next week I did something harder, and the third week I did something much harder, which was asking my boss at that time for something I really needed. And it wasn't actually money, it was more vacation time. So when I got on the phone with her, I said, I need to talk to you. She's like, oh no. Because she immediately thought I was going to leave, and I was like, oh, this is great. I should have asked for everything. I was like, I need a new office, and what I really asked for was, I said, look, I need to take a little bit more time. I'm not asking you for additional money now, but I really need. She's like, oh, shoot, that's fine. I'm like, oh, great. So here's the thing. Sometimes when you ask, and you know what? If she had said no, I could have taken a no. We have to be prepared to take no's if we're going to take risks in our lives. Women tend to blend in too much. You go to great lengths to avoid attention, and we remain silent. And all those things together really make it so that those of us who are really skilled, I mean, look at more women are graduating from college now. More women are getting graduate degrees. Women are so bright, we're so able, we're so competent. But if we don't use some of this bravado and take risks, we're not going to go forward. And the numbers that I quoted earlier, the 15% of all women who are in the boardrooms, 16% who are in the C-suites, I mean, we have to get women in those places of power. And the companies who have more women do better. And companies can be hospitals, banks, I mean, it's comprehensive. And so bringing women in, plus we deserve to be in those jobs. We're really good at them. And one of the studies that I read said that when women are in some of these companies, they tend to make the men in the companies take less risky actions. So there was one study that was done that a woman who was in a boardroom with a bunch of executives, and they were about to sign a huge deal. She said to the president of the company, can I just talk to you outside? And he's like, yeah, but this is not a great time. She said, I need to talk to you outside. She said, there's something that smells wrong with this. Women's intuition, female intuition. He's like, no, it's fine. She's like, no, I am telling you, this is a huge deal that does not feel right. There's something wrong. I don't trust this guy. There's something wrong with this. So the president was like ballistic, and I read through the whole study. He's like, fine. All right, we'll take 24 hours. We'll do some additional research. Guess what? She was right. There was like a terrible skeleton in this company's closet. I'm sure all of us have had those moments where we've gone, you know, this doesn't feel right. So these attributes that women can bring to any sort of workplace are really important, but we have to get ourselves there. So what I wanted to do was to talk about a little bit about what happens when we take risks. So, and this is the health side, is a very complex psychological process is cued whenever we access a potential risk. So you'll be thinking about a risk. when I had to sign this bank loan, I mean, I'm sure this happened to me, even though subconsciously maybe I just like threw it away. But what happens is a kind of cost-benefit analysis occurs, and you compare outcomes against likely costs. And this is something that women across multiple studies approach much more conservatively than men. And when we fear that an outcome is going to be negative, especially negative financially and professionally and emotionally, we usually avoid it. So a risk will come up. A psychological process is cute, and it's, we'll get Vonna to explain the brain cell thing. I mean, I don't know that stuff, but I know what happens is we automatically go into this mode, and then if we see any kind of fear of negative consequences, of professional consequences that are bad, of emotional consequences that are bad, we shut it down. Now, how can we overcome some of those innate feelings? They just happen to be what we are. That is some of what makes women women. That is why women also, I think in some ways, probably are the ones that are the people that have babies. I mean, if men had to have children, we would not exist as a race. Am I correct? I'm correct. There's no way they could go through all that. There's just no way. There's no way. And so I think we do some of that because we have been bred and taught and to be very careful in many, many ways. And so I think what happens is these are the fears that I see as I work with women, and then these are what the studies show. Women fear negative outcomes. They fear that their credibility will erode. They fear losing a job. They fear being the center of attention. They fear spending. I mean, how many of us are like, oh, I can't spend that. I should not spend it. They fear hiring. They fear failure. They fear to investigate new revenue models. If you have a business, they're afraid to sell the business. They're afraid of partnerships. They're afraid of new geographic markets. They're afraid of physical risks. So these are sort of a complex of different fears that women feel, and what we have to look at now is ways to overcome and build your confidence and to enable you to take calculated risks that can really change how you think and feel. And I think that I've done this over the years, and I've seen that I've been able to instill this in some of the younger people that I work with, and I've seen them modeling their behavior after mine. And I hope that as women that you can help mentor other women. And so I have an associate who's in my office, and she's younger than I am. She's in her early 20s, and she's a rock star when it comes to the internet. She runs circles around me. I can't do any of that stuff. She taught me all my social media, all that stuff. So, but she fears the phone. I grew up in an age when I've always been selling and marketing. That's been part of my life. And I always had to do by phone, because how else could you do it? If you sent a letter, you wouldn't get a sale for like a week, right? And then there were fax machines, but I mean, you didn't send an email and say, do you want to buy this? Yeah, I mean, so you can decide if your fears or your risks are really what your meter is. I think I have a much higher risk meter. That is just who I am. My sister does not. My sister is a doctor. She's an internist, and she's in palliative care now, which I think in some ways is very risky. But when I said to her, I'm going to start another business, she's like, oh my God, I could never do that. I couldn't take that alone. I'm like, really? And I said, I'm going to invest in this business that I think it might do great. She's like, I would never do that. I just do like traditional stocks. I'm like, whoa. So there's this whole difference in who we are as people. So you have to decide sort of what level your comfort zone is and be prepared to be thoughtful about where you need to go. But overcoming fears and risks, you need to reframe a lot of times where you are. And sometimes you need to view those risks as positive as opposed to negative. View the risks as opportunities. View them as the ability to be innovative and forward-thinking, as opposed to something that you should fear or something that will overwhelm you. And this is really hard to do. I'm not saying that this is easy by any means. And if I do it once a week, I'll feel like I have succeeded. I don't think I can do it all the time. I could certainly do it more if Vonda gave me some more testosterone. So I want all of you to go up to her after this and ask her for some. And I think she'll enjoy that. So really, you're the only one that can decide sort of your risk meter, your fears, how much risk, how much reward you're willing to take, and be thoughtful about where you are, but you know that you're going to have to overcome some fears. But, I mean, for those of you who have had children, I mean, is there any bigger fear than raising a child? I can't think of one. I mean, that has constantly scares the heck out of me. I mean, and they're old. They're 23 and 19, and they still scare me every day because it's easier to go to work than it was to raise children. I realize that's why God invented offices. I mean, all of a sudden, when my husband went off to his office, I'm like, wait! And I thought I was going to be the mom who was going to stay home in a rocking chair and bake those damn cookies. And I was, 1 week later, I'm like, that's it, I got to start a business. I can't do this. I was nice. I had a parent business where I worked out of my home. My daughter was a big part of it. And, you know, if you can blend family and work, it's really nice. But in some ways, I think that I do believe that women can do it all. You cannot do it all at the same time. You cannot. You cannot multitask, and you cannot have everything that you want at the same time. I couldn't do this job 5 years ago. There's no way, because this is like a 24/7 job, but I love this job. I'm helping women start and grow their businesses. It's very cool. But you have to decide where you are in your life stream and what you can do and what you should not do at a certain point in your life. And if you take on too many things, then you're just going to feel overwhelmed. So steps towards building confidence. And it's the confidence that will let us take on risks. So realization is really important. You have to go and think about what's going to happen.
I'm Jennifer, I'm 40, and I love my Botox.
I love not seeing those lines anymore.
I'm in and out in about 20 minutes.
You can tell there's a glow in their face.
I don't feel 60, I don't look 60, I mean, I feel great.
I love it here at the Skin Center.
Bye-bye, crow's feet.
Find your own beautiful at Pennsylvania's #1 Botox provider, the Skin Center, with one of our introductory express offers starting at just $99.
I'm aging beautifully.
The federal health insurance marketplace is now open. That means you're free to shop for the health plan that's right for you. UPMC Health Plan has some of the most affordable plans on the marketplace. And they all give you full in-network access to UPMC, plus other doctors and hospitals in your community. Visit upmchealthplan.com or call 1-855-297-UPMC to learn why so many people have chosen UPMC Health Plan. Enroll today.
You have to say, okay, if I ask for this raise, I got to visualize the entire process. I'm going to go in, I'm going to have my papers, I'm going to talk to this person about why I need to get to this level, if I'm going to go and ask for a huge sale, if I want to change my company structure. You have to have your data and your research. You better go in really smart no matter what you're doing. I mean, that's the most valuable tool you can have, is to be really smart with the information that you have and know that you're going in. Because if you go in and you don't know your stuff, don't do it, right? So you've got to do your research, and then you really want to visualize, and don't assume that your past experiences are going to be your future experiences. Just because it happened before does not mean it's going to happen the next time. And I think that we think a lot of times that that's true. I think men don't think that way. I think their hardwiring is a little bit different. They're like, last time I lost that deal, but I'm going to go for that deal now. And I think we have things to learn in terms of that. So here's other tips. Dress sharp. There's a long time when I used to work out of my home. And it's easy when you're working out of your home to be in your sweats, right? That does not do a lot for your morale. So dressing changes a lot how we think and feel. Walking faster. Like, you'll see me just blowing down the halls. People will say to me, why are you going so fast? I'm like, I don't know, that's just how fast I walk, I think. Now, my dad was a fast walker, a really fast walker. He was in law school. Ralph Nader happened to be in his class in law school. My dad tells this story that one night he was working really late, and he's charging down the halls, because I am a lot like my dad. Remember the 30% genetic and the 70% is what you make? I got the 30% genetic, a lot of it from him. And Ralph Nader said to him, Ben, why are you walking so fast? What? You're always walking so fast. And I realized at a certain point in my life that I do the same thing because part of it is just getting charged to get to the next thing. So just constantly like charge yourself, like you have to do that. You have to have good posture. When I meet somebody who says hello to me like this and shakes my hand like this, I just want to die. I do not want to do business with that person. I don't want to engage with that person. I don't even want to like that person. I mean, that's so mean. It's so mean. It's really mean. But I mean, really, you know? And I've had men do that too. I'm like, oh God, that's awful. So, and you got to look people in the eye. How many meetings have you had? How many encounters have you had when people don't look you in the eye? And it's hard to do because if you are nervous about something or you're afraid, it's easy to look down. It really is. I mean, it really is. Or you're like, ah. So you have to learn a lot about risk and fears too. Like there are 1 million books written about this stuff. But go in and do some research. Find out about what risks really are similar to the type that you feel in your area, your field, whether it's personal risks and you want to do something and change your life personally, your family, your husband, your kids, or it's a professional risk. And you want to talk with people. I'm a firm, huge believer in mental health support. I mean, if you have an ear infection, you go to the freaking doctor. But if you have problems trying to decide something major in your life, people are like, psychologist, I'm like, come on already. We have wonderful people who are doctors in the world, wonderful psychologists. Use all the resources available to you with professionals to help you work through risks because that's what they're there for. And if you have weaknesses, figure out what they are and accept them and try to work through them and use whatever tools you need to work through them. You know how I feel about exercising. You got to do it every frigging day. And you got to do it in the morning too. I mean, if you can. If you can figure out how to do it in the morning and wake up in the morning, literally at 6 o'clock, I was on the damn exercise bike finishing my notes. Now, I know that is really crazy, but if I don't do it, it never happens during the day. And it also helps me work better and feel better during the day. And I never really thought I believed that until I started doing that. All right, ask and negotiate. And then learn how to manage the risks. So a lot of people also will conserve cash forever. Women in business tend to do that. If you keep holding on to your cash and you don't ever spend it, like why do you have it? I mean, really, you gotta right, Jackie? Spend that damn cash. I mean, if Laura Shapiro didn't spend her cash and buy all these gas stations, Jackie used to work at Giant Eagle. I mean, where would you be? She's a $10 billion company, Laura Shapiro is. And she's gonna be a $20 billion, but you better believe she's leveraging her money. It does not do a lot of good to sit in the bank. And maybe professionally or personally, you need to get a new degree. You need to take a blank. You need to work with a trainer. Okay, well, go do it. I think some of this hit home to me personally, and some of you know this, but this summer my mother-in-law, a very active 77-year-old woman, great shape, doing great. The only thing that was wrong with her was 2 years ago she had breast cancer, and she just did radiation, just a small amount. She was a nurse. If she had started in my generation, she would have been a doctor. I mean, she was that good, that competent, that smart. June 15th, she had a full checkup. Everything was fine. July 1st, and this was from her breast cancer, her follow-up. She lives in Chicago. That's where my husband's from. And June 15th, everything was great. July 1st, she's like, I don't feel good. July 15th, she's like, I really don't feel good. Now, she's a nurse. Those of you who are in the medical profession know that unless there's a lot of blood involved, or you're falling on the floor, you don't really go to the doctor and she had 4 boys, right? So, I mean, she needed real blood to think. So July 15th, she's like, that's it. I don't feel good. I'm just going to the doctor. Well, it turns out, tragically, she had acute leukemia. I mean, really bad. Really bad. 2 forms, AAL and AML for those of you. And she passed away August 2nd. And this is a woman who, I mean, she's 77, that's the new 50, am I right? And it was such a shock to all of us, and we went back and forth. And my sister, who is in palliative care, is the one who said to me, go, you don't have much time. And I realized through that experience, and I'm realizing it now too, that there are no guarantees on time. I mean, this is a woman who, she had planned her husband's and my father-in-law's 80th birthday, which is in October. I mean, she was like, she's there, she is with us. And all of a sudden she was not there. And I think there's no guarantees for any of us. So some of the risks that you need to take or should take are ones, I'll get to you in just a sec, are ones that, you know what, could change your life in so many ways. And I think for her, when I think back to honor her, one of the things I wrote in one of my director's letters, and if you can sign up for our newsletter, my website is there. In my last director's note, I wrote about one of the ways I was going to honor her was to not multitask as much as I say that we don't, because I don't, and she never did. She didn't even have a cell phone that she used. When she cooked, she cooked. When she read, she read. She didn't care about baking all that nonsense. She used to have all these great magazines. She worked. And she never missed a party. She always told me that there's so many reasons to celebrate. Always go to all of them because there's always sad stuff all the time. So I think the combination of all those things and realizing, you know, if I don't take risks now in certain things, when will I? So I just impart that to you because it was one of those big things. So the only advantage risk has over you is fear. Risks and fears are the excitement of life. They can make life more interesting, and they can dispel boredom. Fear of taking risks can turn a hero into a coward. Fears of taking risks can turn a hero into a coward. And so you need to really think about that. And fear of actually living the life you deserve will end up driving you into a really secluded place. So when in doubt, shun the fear, take the risk, and you will be a happier person for it. Psychologists think that risky behavior, risk means like engaging in unprotected sex. It means driving too fast. It means things that have fatal consequences. So when you go to the other side, you talk about calculated risk to sort of counter that, what you think is risky behavior. But you're right, there needs to be something in between, like calculated, free-spirited risks. I don't know, I mean, but you're right, because if you think too long and too hard, you'll convince yourself not to do it. One of the things that I tell women that I work with is if you are not networking once a week, you are not doing your job. I don't care if you own a company or you work in a company. You have to be networking because networking has the word work in it. So people say, oh, you get to go to all these events, it's really fun. I'm like, no, I want to be home in my pajamas, watching a great show or reading my New York Times. That's all I really want. So I put myself in situations where I know nobody because I have to meet new people. How am I going to grow this business? I'm an entrepreneur. I have to grow this business, the Center for Women's Entrepreneurship. It's risky to go up to people and say, hi, I'm Rebecca. What do you do? You know, or hi, I'm Rebecca. I don't know anybody here. Will you help me out? So part of it, I think, is you're right. You have to put yourself in positions where, again, don't think about it too hard because then you're just going to be like, really? But risk is really a part of life. And I think women are more afraid, and this was another study that came up, to look stupid. We are afraid to look stupid. And, you know, so you need to figure out how you're going to increase your risk tolerance. And sometimes you have to be ready to fail. Like, accept the fact that sometimes you're going to fail. You will fail. And I don't think any of us like that. Like, women don't like to fail because we like to control everything. But you might fail. And I think something else is become more risk aware. So start looking at the opportunities to take risks. I think sometimes we just have blinders on. Like, I would never apply for that advancement job. I'll never start my own company. I'll never change my family and life situation. Well, maybe you really need to. You really need to. And so that's important. And I think risk-taking can really make you happier. I mean, that's sort of what life is made of. And indeed, life is really short, as I just recently found out, to live too comfortably. I mean, comfortable is good, but comfortable is a little boring. It can be boring. So, and comfortable can really be nice too. I mean, there's days when I'm like, I am so glad I'm not doing anything. I just want to sit here. So I think it's that really fine balance.
Thank you so much for joining me this week for this episode of Hot for Your Health. You know, you are a powerful force in your own health, and I'm excited that you took the time this Thursday to learn more from our nation's authorities in health. I hope that you subscribe so that you don't miss one single episode. Join us next week for Hot for Your Health. And for more information, find it at womenshealthconversations.com.